Thank you for taking the time to visit the Paramedic Prescribing Research website. My name is Adam Bedson and I'm completing this research for a PhD at the University of Southampton, funded by the National Institute for Health and Social Care Research. In this brief introductory video, I provide a brief overview of the research topic, Paramedic Independent Prescribing, alongside the planned Mixed Methods research project. Independent prescribing, sometimes also referred to as non-medical prescribing, is undertaken by appropriately trained healthcare professionals who are able to assess patients, diagnose what is wrong, and then prescribe medication appropriately. Independent prescribing has been undertaken by nurses and pharmacists for many years, and more recently has been introduced for other non-medical healthcare professionals. Paramedic independent prescribing was introduced in 2018, and since this time, more than 1,000 paramedics have now trained in independent prescribing, using it in a range of settings where they work. These include not only ambulance services, but also GP surgeries, emergency departments, and urgent care services, which include minor injury units, urgent care centres, and out-of-hours services. It is anticipated that paramedic prescribing will lead to a wide range of benefits for both patients and the NHS. These include providing patients with better and more timely access to medicines, enhancing paramedic practice to enable them to deal with a wider range of conditions and treat more complex cases in the community, whilst enabling them to work more effectively as part of a wider team of professionals within the NHS. However, at this early stage, a number of potential limitations to paramedic prescribing may exist, alongside some barriers to its delivery, particularly for paramedics working in emergency and urgent care. These include restrictions from the law which prevent paramedics prescribing what are known as controlled drugs. These include painkillers and sedation, which are often needed in paramedic practice. Whilst the law does allow all paramedics to administer some of the controlled drugs to patients, such as the strong painkiller morphine, currently prescribing paramedics cannot prescribe drugs like morphine, which can be an issue if a patient needs a supply of a drug like this, rather than just a one-off dose in an emergency. Another potential concern is around the training and experience of paramedics training to become prescribers. During the proposal work to introduce paramedic prescribing, concerns were raised as to whether prescribing paramedics would have enough training and experience to prescribe for the wide range of conditions they can encounter, and the initial proposal was rejected due to these concerns. It was therefore later agreed that prescribing paramedics would need to have an advanced level of training. However, it appears that currently not all prescribing paramedics are following these recommendations and completing the required training before starting prescribing. Concerns have also been raised as to whether prescribing paramedics working alone in the community, such as in ambulance services, currently have enough access to patient medical records to prescribe for them, or if they can easily access advice and support from a doctor or other experts for help with prescribing decisions when needed. Importantly, very little research has been completed around paramedic prescribing, and so it is not yet clear if and how it is benefiting patients and NHS services, or if there are limitations and barriers to its delivery. This research study plans to contribute to building the research evidence around paramedic prescribing so we can better understand how it is currently being used to treat patients, whilst understanding what the current limitations and issues are to maximise the potential of paramedic prescribing for patients and the NHS. In order to do this, the study has a number of important research aims. These are to more clearly understand which medicines are prescribed by paramedics working in emergency and urgent care settings, and the conditions they treat. It would also explore the views and opinions of a range of subject experts to understand their views on the benefits and limitations of paramedic prescribing, including how it is currently contributing to patient care and NHS service delivery, and how they feel it can be improved. The study will also aim to understand how the training and education of paramedic prescribers influences their prescribing, how prescribing has changed practice, and if paramedics can access support for their prescribing when needed. In order to provide answers to these questions, we plan to use a mixed methods research design to collect and integrate research data from a range of approaches. This will include reviewing in detail the current research literature on paramedic prescribing and the wider literature on independent prescribing by other professions such as nurses and pharmacists, which will be important for both the design and data analysis of our research. We will then interview a range of subject experts, including senior paramedics, NHS leaders, senior academics and policymakers, doctors and health commissioners to gain their valuable knowledge and insight across the range of research aims. During the next stage, we will conduct case study research at an ambulance service, emergency department and an urgent care service, obtaining data on the medicines prescribed by paramedics in each setting, and observing the care they provide to patients. During these observations, we will also seek the views and opinions of the paramedics and their colleagues about paramedic prescribing. All of this work will be used to design an online questionnaire to be completed by prescribing paramedics from across the UK. Throughout the entire research project, we will work closely with a team of patient and public contributors who will provide valuable insight and feedback and help us plan and undertake the research. In summary, this research aims to contribute to the research evidence base surrounding paramedic independent prescribing in emergency and urgent care, to more clearly understand how it is contributing to patient care and NHS service delivery. Through work with key organisations and policymakers, the research findings will ensure we maximise the potential of paramedic prescribing for patients and the NHS. We hope you have some time to look at the different sections of the website, which provides more information on the research project. These areas will be updated regularly as our study progresses. If you have any questions or comments, please feel free to contact us through the form on the website. Thank you very much.